comes on the risk factor for osteoporotic fracture. Because whenever the topics on the osteoporosis, the development of osteoporotic fracture comes on parallel. So what are the risk factor for development of osteoporotic fracture? First one is the female sex and second one is the advanced age. I will explain these two things together. Because we know that the peak bone mass actually in age 20 to 45 years. And after that, both bone mass getting declining. And it persists up to the 55 to 90 years of age. So why female? Because this declined bone mass or the peak bone mass that is reduced, which is 15% to 20% is more in case of female than in male. And another is we know that the postmenopausal women is then up to the next 10 years, their bone mass is declining very rapidly, per year 3%. But in age 65 to 70, the decline is reduced, and in age of the 75, the bone declining is 0.5% per year. So that's the why the advanced age and the female sex is risk factor for developing of osteoporotic fracture. Third one is the inadequate physical activity. So we have to be physical active to better mineralization of our bone, for the maintain the bone mineral density of our bone, for the better calcium metabolism of our bone. Estrogen deficiency, and altogether comes also the testosterone deficiency, because this estrogen and testosterone responsible for the bone resorption and increase the bone formation. So reverse condition will be happening in their deficiency state. Corticosteroid is, I already told about the why, how and when corticosteroid will develop the osteoporotic fracture. Vitamin D deficiency, low lifetime calcium intake, impaired eyesight despite correction. I mean, even after correction of the by a spectacle patient having the impaired eyesight, they will develop the osteoporotic fracture as well later on. And the current smoker, they also prone to develop the osteoporotic fracture. Low body weight. So actually we are running rash on losing our weight, going to gym and doing so many stuff. But the one good news, those already have not having heavy weight, that is they will not prone to develop the osteoporotic fracture as well. And another some factor that is development of the osteoporotic fracture, and they are the personal history of low impact fracture, current low BMD, and hip fracture of either parent. Raise if patient have the dementia, recurrent falls, poor health and the frailty, testosterone deficiency and alcoholism. So risk factor for falls, that was the osteoporotic fracture, risk factor for the osteoporotic fracture. So osteoporotic fracture patient also can develop, reason behind this is the falls. So what are the risk factor for falls? If patient have the muscle weakness, we know that myopathy patient have muscle weakness. Even when we get some medication like the statin, beta blocker or something like that, they also develop the muscle weakness, and that patient prone to development of the falls. Gait or balance abnormality. We have to keep in mind that if patients, what actually maintain the gait and balance, the musculoskeletal system as well as the neurological system. A neurological system, patient vestibulocochlear nerve, which is also responsible for the balance. So any abnormality of this system will patient get risk factor for the falls. If patient already have the walking aid for their balance, that is the impaired activities of daily living. So if this condition already, what I have described before in previous slide, already have present in a patient, so their activities of daily living also ultimately hampered. So this patient also risk factor for the falls. Any chronic condition patient will develop the depression, or patient have underlying cognitive impairment, age already have more than 80 years, patient have the taking for another reason any psychotropic medication, this patient prone to development of falls.